If I told you that 1 in 8 women will be diagnosed with breast cancer in their lifetime, that number may surprise some of you. But the facts do not lie. Dr. Anna Chen at Windsong Radiology realizes she cannot change the number of women diagnosed with breast cancer, but she can certainly increase the survival rate by detecting breast cancers in their earliest stages.
It's super important to get your mammogram every year. A lot of people think that maybe it's because I don't have any family history, I don't need to worry about it as much. But I will advise them that most people that we diagnose with breast cancer don't have any family history. A majority of breast cancer is not genetic, so that's why it's so important to get screened every year, especially beginning at age of 40. Yeah, as we all know, we took a pause in terms of screening just because of national guidelines, and that was last April through June. And it was because of the lack of ability to screen patients. We have a significant backlog of women trying to get in for their exams. So what we've done is we've added additional staff, we've added additional hours to help accommodate getting these women in. By limiting some of the results, we have been able to see more women. So our idea is to get as many women in that have missed their mammograms or are delayed, just so that we can get them screened. We do provide same-day results for all patients. If a patient wishes to speak with a physician and they're anxious, they are more than welcome to ask to speak with a physician, but we are still providing same-day results.
Dr. Chen noted that having yearly mammograms assists the board-certified, fellowship-trained radiologists at Windsong better detect cancers in their infancy. A 2-year wait between exams is simply too long.
Having prior mammograms is imperative in terms of detecting cancer early, and what we look for is when we're comparing year to year, what we're looking for is actually very subtle changes, and those subtle changes could be important changes, and if we notice anything, that's when a patient will have additional imaging and to see if it's of anything importance. But that's the whole key with mammography, is to compare with the prior studies, because the subtle changes are what could be the start of a very early cancer.
Currently, Windsong is recommending that patients wait 6 weeks post-COVID vaccination for breast cancer screenings, but if there's a concern, they say you shouldn't delay. They stress the most important action is to have your images examined by a radiologist specializing in breast imaging. Windsong has been recognized nationally as a breast cancer screening center of excellence, which starts with their multidisciplinary approach.
It is important to who reads your mammogram. So it's important to have a dedicated breast imager, because we've gone through the training of how to look for the breast cancer and all the different ways that it can present. It's also important that most breast imagers have that passion to, find that breast cancer and, help women live their best lives possible, detecting cancer as early as possible. And by the sheer volume of the mammograms that you read, you become better and better as a breast imager. So what happens is when there's a difficult case or an interesting case or something that we just need a little bit more feedback on, it will be presented at our case conference, and we'll discuss how they were diagnosed and all the different options that are out there. The surgeon will discuss how they plan on treating it, and all the other disciplinary limbs will give their input to see if they agree or if they disagree, and if there's any new data out there that could focus the treatment in a different direction. I think it keeps Windsong and the patient's care on the top notch of treatment. It brings in the newest and the most recent recommendations out there, so that they can get the best treatment and options available.